Thanks, Phyllis. I'm Paul Greve from Willis's National Healthcare Practice, and in my role at Willis, I try to closely follow national medical malpractice trends as they occur. Every year I do a lot of write-ups for Willis, publish a number of articles on what we're seeing at a macro level with regard to national medical malpractice insurance trends and national medical malpractice claim trends. So what I'm here to talk to you today about is the financial impact of failed communication. Like Phyllis, I have a hospital background. I'm not a nurse. I don't have a clinical background per se, but started my career at the Cleveland Clinic working as an administrator in the cardiovascular area. So had to learn a lot by default about clinical issues, and certainly in my career, as I progressed in my career, first as a risk manager, then as a lawyer, then as an insurance executive for Medical Protective. Now at Willis, one of the largest international insurance brokerages, you see the patterns of claims as they occur over your career, and certainly I've seen examples of failure to communicate critical test results, pop up in the claims that I've personally been involved in the national trends that I study as well. So and I really started in this field in '75 by writing a paper for a course in hospital administration at Cleveland State University. My topic was the malpractice problem, because that was when we first began to have one. And while the current environment today nationally is among the best of the last 4 decades, large verdicts and settlements do occur, especially with younger victims. And the most difficult cases to be involved with are children and adults with dependent children. Those are the most volatile cases that we have in terms of defense. And Phyllis ran through some of the examples that we see coming out of this area, but some that immediately jumped to mind for me were breast cancer cases, misdiagnosed acute myocardial infarction, misdiagnosed heart attacks, and then meningitis. And I spent a lot of time, having worked in 2 children's hospitals in Ohio, Columbus Children's and Rainbow Babies and Children in Cleveland, I've had sort of a career-long interest in issues in pediatrics. And as I look at the national trends right now, the most difficult cases occur in pediatrics and obstetrics. So meningitis cases are amongst the most difficult involved with pediatrics. When we're talking about these kinds of cases of failure to communicate critical test results, aggravated facts can make these cases even more difficult to defend. Any defense lawyer, would tell you that, and that's what we're up against frequently in these types of cases. A system failure in communication of critical test results in a case involving a younger victim can really create the potential for a claim payment in multiple millions of dollars. So investment in the patient safety technology to prevent these claims is certainly warranted, and a number of insurers, especially on the hospital side, excess insurers, reinsurers especially, are beginning to recognize this with premium credits or return premium if certain goals are met. So the topics I'm going to quickly cover for you are those 3 listed there: closed malpractice claims and CTRM, critical test result management, physician specialties and examples where this is an issue, and then some quick comments on hospital physician underwriting approaches to patient safety. Well, one of the things that's frustrating about being in our industry is the lack of comprehensive closed claims data. There just isn't a whole lot out there. There's more on the physician side thanks to the PIAA. There's not quite as much on the hospital side. And what is out there is frequently not enough it's not granular enough to attribute delay or other communication issues with regard to critical test results. However, we know, and certainly Phyllis gave us some examples earlier from their claims, that our sources that are both proprietary and anecdotal indicate that there are issues when communicating critical test results that become a big problem in medical malpractice cases. And we also have certain Physician Insurers Association of America data sharing project categories that point to this issue, such as failure to supervise or monitor the case, communication between providers, and laboratory error. The PIAA, as many of you know, is the Physician Insurers Association of America. It's a great organization. They're really the trade lobby for the medical society-owned carriers that sprang up in the late 70s and early 80s. Certainly they've expanded the membership beyond that, but their primary goal is insuring physicians. Their cumulative claim study dates back to 1985, so it's one of the most credible databases that we have out there, especially for our physician clients. In it right now, there's more than 230,000 closed claims, roughly 40 for their member companies report. And one of the things that they do every year, in addition to issuing an aggregate report, they look at 24 of their 28 specialties, and they issue what's called a risk management review. And they go into depth in looking at the claims trends in that particular specialty. So I find that particularly useful for education programs for physicians, and for also going back to hospital quality people and saying, here are the types of things you should be looking at for evidence of substandard care. If we look at specialties and claims where this is an issue, virtually all specialties, and we had this discussion amongst ourselves as a panel, it's hard to think of a specialty that wouldn't be impacted here. Maybe come up with a few like allergy or something like that, but just about every specialty is going to be affected by critical test result management. And the physician's initiated communication of critical test results can be at fault, as well as the physician receiving. And if this becomes an issue in a particular malpractice case, it can often result in high damage claims because you get into aggravated facts when the jury hears that something was not communicated. And it's particularly a problem, and again, it was wonderful to hear what Phyllis had to say, because it certainly was tracking what I was thinking and what we're seeing in the PIAA data as well. What are the most egregious cases? Well, breast cancer, lung cancer, colon cancer, gynecologic cancer, when pap smear results don't get communicated. And then the one I'm going to pick out today, because I'm a bug on pediatrics, no pun intended, is meningitis, failure to communicate with regard to that. So let's look at meningitis claims and critical test results. Meningitis, I asked the PIAA a couple of years ago, I said, when you look at that specialty, what concerns you the most? Instantly, meningitis claims. And when you see the data here in a second, you'll see why. More than 1/3 of their total indemnity paid in the from the PIAA companies for the 10 most prevalent patient conditions in the specialty of general pediatrics was for meningitis. So a huge chunk of their total indemnity is paid for meningitis. They commissioned a special study 10 years ago just on meningitis because it's such a problem. And they cited poor communication among providers as an associated issue in 12.3% of all their meningitis claims. And my suspicion, again, is that I think Phyllis is probably right. They're probably underestimating that as an issue, much like Phyllis thought with regard to the Princeton data. And within that category, though, they did say failure to inform of critical test results was an issue within meningitis. In the 2009 PIAA Pediatrics Risk Management Review, that's that very focused study that they take at 24 of their 28 specialties, communication among providers was an issue in 161 claims of all types in the cumulative study. But if you looked at that category, it had a very high percentage of paid to close claims at 40.28%. And I would say typically, if you look at all the PIAA data, the numbers of closed claims with payment is down around 30%, so now you're up at 40% in that category, and a high average indemnity at $416,559. So these are really expensive claims. And this next slide bears that out even more. I just isolated the category of meningitis amongst this review of claims by 10 most prevalent patient conditions, again taken from the most recent PIAA Risk Management Review study on pediatrics. So meningitis claims is roughly 16% of all their claims, but look at the percentage of paid to close there. You're starting to creep up towards 50%. So defending that type of claim where you end up with either a dead child or a severely neurologically compromised child becomes very, very difficult. And 1/3 of the total indemnity that was paid overall out of those 10 conditions was paid for meningitis. And the average indemnity, as you can see there, at $444,000 is far above the norm of $335,000 at the bottom. So very expensive, very volatile claims. And here's pediatrics by 10 most prevalent medical misadventures, and what I did there was I isolated the claim of failure to supervise or monitor the case That represented just under 10% of all the claims in that category, but the percentage of paid to close claims of 35.61% is well above the norm of 27.54 down there at the bottom. A good chunk of the total indemnity in this category is represented in that $73 million, and the average indemnity is well above the norm at $322,558. Well, I think underwriters are beginning to understand the importance of this issue, and in some informal polling that I did, I found that there's a mixed bag in terms of physician underwriters willing to grant upfront premium credit for patient safety technology of all kinds. And I'm very excited about the kinds of things that we're seeing being developed to help prevent claims that are out there. Dr. Papp's going to follow me here, but when I leave here, I'm actually flying to Washington, D.C. and giving a talk at an obstetrics conference. And the company putting it on is a company that develops bedside technology to promote better communication, better handling of obstetrical situations so that they do not result in malpractice claims. So there's a lot of companies out there that I'm very excited about that are helping us in this industry with regard to preventing claims. Some hospital and excess insurers and reinsurers have been formally and informally recognizing these kinds of companies and offering premium credits for patient safety technology. And if you think about it, obviously the hospitals are the deep pocket of these claims. Physicians carry low limits of liability, and the hospitals are carrying limits of liability in the tens of millions of dollars. So the hospital excess underwriters are very sensitive to the shock loss that can occur, so they're incented to offer premium credits. And there are some examples of informal programs for hospital premium credits that are offered by these three excess insurers and reinsurers. Again, these are folks that are putting up usually tens of millions of dollars of limit. They don't want to see the shock loss occur within their layer. Beasley Syndicate at Lloyd's that offers a return premium for using certain patient safety technology. Endurance Specialty out of Bermuda and Allied World out of Bermuda is offering this as well. And this is in addition to some of the domestic U.S. carriers that may not have a formal program, but they'll give some premium credit if the hospital can show that they're using certain patient safety technology. And I've listed some of the companies there that are offering those kinds of things. The other thing that's important to note here is that many provider-owned captives are providing grants or premium credits back to member hospitals if they make these kinds of investments in patient safety technology. So, winding up my thoughts on our topic today, critical test results are a real issue in malpractice cases. When there's a failure to manage them, they create aggravated facts that drive up the case's economic value, and we may be in a situation where the claim is worth multiple millions of dollars. Patient safety technology like critical test result management can help reduce claim frequency and especially severity, and the underwriters in our industry have begun to recognize the benefits of patient safety technology, and they're beginning to offer premium credits or return premium for their use. And now I'm going to turn it over to Dr. Peck.